Alrighty, good morning and welcome to Ask the Doctor. I'm your host, Dr. Michael Lange, as usual, here each and every Saturday morning live to answer any and all questions you may have regarding your vision and eye care. So please don't hesitate picking up the phones and giving us a call. When I say us, it's Dr. Michael Lange and Dr. Richard Hall, the icon in the sports nutrition world. So this is a live call-in show dedicated to you, the listener, the viewer, and the phone number is 1-877-969-8600. 1-877-969-8600. It's good morning, good afternoon, and good evening, depending on what part of the planet you're viewing and watching us on. And we're live coast to coast via the radio. So who's Dr. Lange? I'm a board-certified optometric physician. I'm a certified nutritional specialist. Founded Lange Eye Care & Associates March 15th of 1993. Started Ask the Doctor April of 1993. So, folks, we've been doing this show for over 30 years. Time flies when you're having fun. And I hail from the Lange Eye Institute in the Villages, Florida. And Dr. Richard Hall does free nutritional consultations and weight loss management for free, believe it or not, at the Lange Eye Institute as well in the Villages, Florida. I'm also the founder of Fortifeye Vitamins. And we talk a lot about our slogan at Fortifeye, which is the right ingredients, the right science, right for you. You know, I'm pretty famous for saying that God made a pretty good body. As long as we give it the right fuel, that body can perform at optimal levels and last a good long time. The problem is it's hard to find the optimal fuel at the local vitamin shops. So that's why I developed, once again, the Fortifeye Vitamin line. You can check out everything we develop and all the science behind our supplements. Remember, these are totally transparent supplements. We actually tell you exactly what's in them. There's no proprietary blends. Check it out at fortifeye.com. That's Fortifeye, fortifeye.com. And let me give you the phone number for Fortifeye Vitamins. I'm going to give it to you twice. And I want to say hello and a shout-out to Charlene. Charlene is manning the phones at Fortifeye Vitamins, I think, starting at 9 o'clock this morning. Might not be till 10, but she'll be there on Saturdays now manning the phones, so you can do orders on Saturdays. And I am going to be at the Fortifeye Nutrition Center today in Clearwater about 12:15, and I'll stay around for 2 to 3 hours. So come on, visit and chat with me at the Fortifeye Nutrition Center in Clearwater. That's right on McMillan Booth Road in the Bayside Bridge Plaza right next to Publix. Anyway, the phone number for Fortifeye Vitamins is 866-503-9746. 866-503-9746. And I want to apologize. Last week we ran a tape. The week before we were at a conference, so we ran a tape. So finally we're live in February of 2024. Last week I was in New Orleans, my old stomping grounds. We still have a home right in that area. And I was there with Mackenzie and Tammy. Mackenzie got accepted to Tulane University, and she accepted the acceptance. So congratulations to Mackenzie, my youngest daughter. She'll be going to Tulane in the fall, and she's going to be majoring in biology and pre-med, and ultimately wants to go into sports nutrition. But that could change. You know, things could change. Who knows? She might want to be an architect. Maybe she wants to become an ophthalmologist if I push her a little bit. But I'm going to let her find her own path. So once again, congratulations to my daughter for going to Tulane. And we got a hallelujah out there, I know, after you hear what I'm going to say. Fortifeye Rejuvenate is now in. You've heard Dr. Hall and me and Dr. Somerton talking about it for about a year. We worked on the development of this product for over 2 years, and now it is available. Fortifeye Rejuvenate is the latest in nutritional, evidence-based science to aid in skin, hair, nails, and joint health. We're one of the first in the industry to use collagen tripeptides. That's the big word, tripeptides. Everybody's using collagen peptides, including us and all of our products before. So now we're utilizing marine collagen tripeptides. And what's that mean? A tripeptide is tiny, much smaller than a peptide. It's basically 3 amino acids that absorb much more rapidly with some amazing results. So what we've done with this marine collagen tripeptide, we've added rice ceramides. We've added hyaluronic acid. We've added a superfood combination called Dermaval. And then we've added a liposomal vitamin C made here in America, and a little biotin, some B complex, some C, some D, some E. So it's a formula that has 3 delicious flavors. I mean, these things are delicious. We've got pink lemonade, we've got chocolate, and we've got cherry vanilla, and then we've got unflavored. But Fortifeye Rejuvenate is now available. Also, Fit Pro is available. We've been talking about that for a while. And, of course, the new eye pressure and neurocognitive support for all you glaucoma suspects. All of these are available for Fortifeye, so I just wanted to mention all that. We will be chiming in and expanding and talking a little bit more about that in a minute. Let me give you guys and gals the phone number if you got a question for us. 1-877-969-8600, 1-877-969-8600. I also want to welcome 2 more radio stations, Alexandria, Louisiana, and Chattanooga, Tennessee. Good morning, Dr. Hall. What is going on, my friend?
Oh, my gosh, all kinds of good things, Dr. Lange. First of all, I just want to comment just one little bit on something that you said, just a second ago, about, our new products that have came out and they're on the shelves. It's kind of, folks, it's kind of like giving birth, Dr. Lange and I and the rest of the team, but he and I mainly focus on new products coming out, and we do all the research and the taste sampling and the testing and the juggling of the ingredients and the whole thing. And sometimes that process might not take just a few months. It may take a few years. And not all the time does that product come to fruition. We might get to a point, say it's just not what we want. And we do that quite often. I know a lot of other companies, they don't do that. They'll push it forward. If it's got a flashy name and something in it that somebody wants, let's produce it. We don't do that. And so it's kind of nice to have these 3 products out. And we have more coming. We have more out there, but it's kind of nice to bring these out and get them on the shelves. But anyway, good morning, everyone. Welcome to this edition of Ask the Doctor. We missed you. We're glad you're here this morning. We, as Dr. Lange said, we've been out with projects and doing things the last couple of weeks, but we're here, we're back. So please call in today. It's a live show, and we depend on you. We have a big show planned for you, so pour another cup of coffee or tea and sit back and get ready to elevate your wellness level. Today is National Women's Physicians Day. So a big Ask the Doctor salute to the lady docs out there. And it's also National Carrot Cake Day. If you love carrot cake, you can make a healthy one. But please don't tell me that carrot cake's healthy because you shredded a little bit of carrot on top of it. And I'm not falling for that. As a lot of folks say, but Doc, I add some of this or some of that to it. Doesn't that make it healthy? Not so much, but have a good time with it anyway. And if you want that piece of carrot cake, you know my philosophy, eat it. Especially speaking of dessert, I have a segment today on weight loss and getting your ideal weight on target. And so if we can get to that, but first we want to do the callers. And as Dr. Lange said, we have news and updates on our 3 new products that you've been waiting for. And of course, our show is directed by you. You're the directors. You're our callers. So now is the time to call in. Let's get going, Dr. Lange. Back to you.
All right. And if you hear anything in the background, that's Scuba Scott, my Ed McMahon. And he was just adding the new Fortifeye Fit salted caramel to looks like his cold coffee brew, okay? And my mom does that all the time. Scoobs, how's it taste? Talking to the microphone. It's good, isn't it? And you know what that does? That's adding you some protein. It's adding you a little energy, all right, on top of the caffeine that's in there. So, like I said, my mom puts about a quarter of a scoop in her coffee. Scoobs put a half a scoop just now in his iced coffee. And Fortifeye Fit Pro, like I said, replaces Fortifeye Fit. And this is a combination of grass-fed collagen, all right, German creatine, all right. This is the only creatine that is created in Germany. It is the best creatine. It's called Creapure Creatine. And creatine not only enhances muscle strength and explosive energy, but it also helps reduce cognitive decline. It helps reduce the chance of you getting concussion syndrome. So it's almost malpractice if you're playing a professional sport and you're not on creatine, if your doctors, your sports doctors do not recommend it. So creatine is good for anybody at any age. We have something called PKTP in it. PKTP is adenosine triphosphate. So it gives you energy, clean energy. It gives you a great pump. It helps you recover. It gives you more strength when you're working out. No caffeine, no beta-alanine, nothing that's going to give you the jitters, the shakes, or heart palpitations, or heart arrhythmias. So you got to be very careful with some of these pre-workout supplements that have the equivalent to 5 to 10 cups of coffee, especially if you're getting up there in age and have any history of AFib. That's atrial fibrillation. We have betaine anhydrous, great for muscle, great for your heart, great for lowering homocysteine, great for strength. L-citrulline. So L-citrulline is an amino acid that has vasodilatory effects. It actually boosts nitrous oxide and helps bring these nutrients to your muscles and helps increase circulation to every part of your body. And then we have whey isolate, grass-fed whey isolate. We're the first to combine whey and collagen. So not only are we promoting the muscles, we're promoting the scaffolding. So this formula, Fortifeye Fit, is good for your muscles, ligaments, tendons, joints, skin, hair, and nails. MyHMB, you got to Google this. It's called MyHMB. So HMB has been shown in clinical studies, especially when you add the vitamin D to it, and we have that, and the creatine, to really, it's a triple whammy of improving muscle strength, muscle size, muscle synthesis, recovery, endurance. And so we're the first to take all of these ingredients and put it in what we call Fortifeye Fit Pro. We've got a lot of athletes, world-renowned athletes on it, weekend warriors. We got high school kids. My mom's taking it 96. Half of my patients in the villages, and the average age is 82, is now on this product because it really does bring evidence-based nutrition to your body. Let's face it, we all want to live as long as we can, as long as our quality of life is good. So a lot of you are thinking you're getting older, and this is why you're feeling worse, why you don't have the energy, you don't have the strength. You're starting to get saggy muscles and a lot of wrinkles all over your body. Well, it might be due to lack of movement, lack of exercise, lack of energy, therefore you're not exercising, and lack of the appropriate nutrients. So Fortifeye Fit Pro is not a miracle cure for aging, but it's going to help you. Let me tell you that. It's going to help enhance strength, muscle synthesis, endurance. It's going to make you feel better and look better. So check it out, Fortifeye Fit Pro, on the web at fortifeye.com, Fortifeye, fortifeye.com. You can call Fortifeye Vitamins right now at 866-503-9746. That's 866-503-9746. You know, it's 2024. It's time for you to make a dramatic, life-altering change in your life. It really is. And you, and only you, have the power to make these changes. And you know who you are. A lot of you are overweight. You can pinch a lot more than an inch, right? You drink too much. I'm not talking about water either. So you smoke too much, and cigarettes and all those other funky things. And you can change. In 2024, it's time to change. Maybe your New Year's resolutions can kick in February, all right? Don't go to the doctor and just want another pill, all right? Make an effort to make these changes. Like I always say, God made a pretty good body. As long as you treat it right and give it the right fuel, your body can do some amazing things. It can improve your quality of life and give you some extra years on this beautiful planet. But remember, and Doc Hall and I always preach this, it takes dedication, willpower, sacrifice, determination. And if you can do all this, then you're going to do better. And I say sacrifice. I mean, instead of going out with your buddies to the bar and drinking a couple of quarts of beer, watching the football game, go join one of the local gyms. Go pump iron for, 45 minutes and then do 30 minutes of cardio. Now's the time, 2024. We ain't getting any younger. All right, phone lines are open, 1-877-969-8600. That's 1-877-969-8600. So he promoted and talked a little bit about Fortifeye Fit Pro. I'm going to let Doc Hall expand a little bit on this because, you know, one of the areas that we really kind of specialize in, believe it or not, at the Lange Eye Institute with our patients is not only helping them visually, but helping their whole body. If we make their body healthier, we make their eyes healthier and vice versa. But remember, my typical patient is 78 to 82 years of age and still very active. And they're in that stage of life called sarcopenia, okay? And sarcopenia is muscle wasting. You're getting wrinkly, you're getting flabby, you're getting weak. And, Doc, we can help these people, can't we?
Absolutely. You know, I've fought the case for years, Dr. Lange, as you well know, that, sarcopenia is just not as it's called, a disease of the aging. It is not. It's part lifestyle. It's part what you want it to be. And you hit on it just a few minutes ago. And we shouldn't accept things just because we hit a certain milestone of age in our life, you know, and I hear this honestly, folks, every day. You know, well, Doc, you know, when you hit 60, this happens. And when you hit 70, oh my gosh, that happens. And 80, oh God, you know, and they go on and on. It doesn't have to be that way, folks. It is what it is. It is what you make it. And it can be helped. Sarcopenia, you know, it's a lifestyle thing too. You know, folks, they're not consuming enough protein or collagen, and that's all muscle. That's what I see it every day in our waiting room. When folks struggle to get up out of the chairs in the waiting room, they have to use their upper body to stand up. Reason being is that's the stages of sarcopenia. It's muscle wasting, as Dr. Lange said. The muscle just atrophies. It goes away. It's one of those things, really, folks, that you heard years and years ago. You've probably heard 1,000 times. You know, if you don't use it, you lose it. Well, that's part of it. That's part of this whole sarcopenia thing. As our lifestyle changes, okay, and we morph into that maybe retirement years or maybe just different. I know my life is totally different than it was 20 years ago. You know, 20 years ago, as a competitive bodybuilder, I lived at the beach. I owned Gold's Gym in Pompano Beach. And, well, Doc, how's Gold's Gym doing? I don't know. I sold it. Do you live at the beach? No, I live with some horses up in Ocala. And, it's a life. Is it better? Yes, I think so. But it's a life change. And, folks, that's what we have to compete against every day is those life changes out there. And you can do so much for yourself. With Dr. Lange and I see it every day. If you're overweight, let's get that weight off. I can really help you with that. For every pound that you're, that you're over your ideal weight, it puts 4 extra pounds of pressure on your joints. So if you're 50 pounds overweight, that's an extra 200 pounds of pressure. And it changes for the bottom of your feet. It's 8 pounds of pressure per pound of your overweight weight. And so, you know, if you're 50 pounds, you're carrying around, 4, 5, 6, 700 pounds of extra pressure on your joints and on the soles of your feet. No wonder by the end of the day that you're tired. Of course you're tired. But anyway, folks, I could go on and without a breath here and keep going and tell you that weight loss and getting your weight down to its ideal level is the best thing you can do for yourself. It really is. I mean, things like, blood pressure, cholesterol, joint health, heart health, all of these things can be helped. I mean, to a great degree, and we see it every day. We see the good, the bad every day, both Dr. Lange and I and Dr. Caputi, Dr. Somerton. We see the good and bad every day, and we know what can be helped, and it's a shame that we don't. So, but anyway, folks, try Fit Pro. Dr. Lange and I have been on a version of Fit Pro now for, I guess, about 8 months or so, Dr. Lange?
Right, some prototypes, multiple prototypes, some delicious and some not so delicious. But, and we really have grown our muscles and strength. I mean, heck, I'm over 60 now, and I'm as strong as I was when I was probably 25. And I got to tell you, it really does correlate with the Fortifeye Fit Pro. It really does. The science is legit, and proof is in the pudding. We've got, as you know, lots of patients, lots of friends that have started the original Fortifeye Fit and have done amazingly well. And Fit Pro's only been out for 2 weeks now, but we've got a lot of testimonials coming in that they have more energy with Fit Pro than with Fit. Now, one of the problems with Fit, which wasn't a problem with us because we know about sports nutrition, but we did have some carbohydrates in there, and that helps muscle recovery and helps energy. We did have a little sugar in there, but we listen. We listen to all of you folks out there, and a lot of people are on those low-carb diets and keto diets, and a lot of diabetics can't have the sugar and the carbs. So now the new Fit Pro has zero, I repeat, zero carbs and zero sugar and zero artificial sweeteners. So that's why we put the Peak ATP. Peak ATP is a very expensive ingredient because it gives you that energy. You take 1 scoop of Fit Pro right before you work out, 20, 30 minutes before. It gives you an amazing workout. And then you take 1 scoop right after you work out. That's for maximum effectiveness. So it was designed to help all of you that need help. I mean, let's face it, we all need a little help in the gym. But it's not just for working out in the gym. It's for you that are riding the bike. You guys and gals on the golf course playing pickleball, all right, playing volleyball, tennis, football, basketball, just going for a walk. You know, it will help anybody and everybody. I mean, my mom takes 1 scoop a day, usually in between her meals, and then she takes a little bit of the salted caramel in her coffee in the morning because she likes the flavor. And I got to tell you, Mom's doing well. She's 96, and she still goes and hits the tennis ball against the backboard, and I hit the tennis ball with her a little bit too as well. So 96, she's going strong, and I like to think a lot of that is related to the diet I've had her on for the last 6, 7 years now. And some of the supplements, obviously the Fortifeye supplements. So, like I said, and I always preach this, God made a pretty good body. We just got to treat it right. So the right supplements, all right, the right diet, the right amount of exercise, a little sunshine, a little fresh air, a little positive thought, plenty of hydration, and sleep. And that's the quadruple whammy of anti-aging. Isn't that so, Dr. Hall?
I'm just making a couple of quick notes here, and I just wanted to really expound on something that you said there about our product that we took the sugar out. And as you know, as you said, you know, we realized the reason why we put the sugar in there for recovery, and we also listened to our customers, our patients, and we took the sugar out. However, folks, we did not replace it with anything artificial. Okay, there's no aspartame in there. There's no sucrose in there. There's none of the stuff that you want to avoid. All right. There's also, and I have to make this very clear to folks, there's no stimulants in our formula. Okay, I would just go out on a limb here and say all pre-workouts, and there's no pre and post-workout there other than us anyway, but all pre-workouts here, folks, had a ton of stimulants in there. Okay, can as Dr. Lange always says, you know, can send that heart into AFib, or at the very least, you know, give you cause to what's going on with me here. There's no caffeine in there. There's no stimulants at all. And so you can buy with confidence with us. We've researched this stuff. I can't do stimulants. I really can't. I can't do caffeine and like that. I just don't like that feeling. And but 15 minutes ago, before the show, I did my Fit Pro, and I add some other things to it in our line, and that's my breakfast. That's my go. One thing I want to make a real quick comment on is all you folks out there that are doing pickleball and golf and things like that. Do you realize how much better your game can be with proper nutrition, proper supplements? Okay, like Dr. Lange said, these aren't just for bodybuilders or people that go to the gym every day and like that. No, it's for everyday use. And but you know, you're still an athlete. You're still out there doing things on the golf course, pickleball, and you know, I had a guy in the other day. A patient came to see me the other day. He was 100 years old, and he was mad because his new schedule for pickleball and softball conflict now. So he's on the verge of having to give up one of his favorite pastimes, and he's 100 years old. You know, so you can do it, folks. You honestly can do it. We see it every day, and we just don't want you to miss out on it. Back to you, Dr. Lange.
All right, we're going to open the phone lines. We're getting ready to take some calls. 1-877-969-8600. That's 1-877-969-8600. 969-8600. You're listening to Ask the Doctors. I'm Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins with my co-host, Dr. Richard Hall. And I hit the gym this morning. I got up at 6 a.m. and hit my home gym and worked out back, did some cardio, did the vibration plate, worked out for about an hour and 15 minutes. And then I had a Fit Pro right when I woke up this morning, first thing. I mean, scoop of that with water. And then I worked out, and then Tammy made me a nice egg omelet with some broccoli, kale, and what else? Mushrooms and onions. And I had a 3-egg omelet, and I had some goat's milk with that, all right? So I'm feeling pretty good. Now, we're getting ready to go to the phones in just 1 second. I think we had Janice on hold. She got tired of waiting for us, so you can call us back at 1-877-969-8600. You know, when it's raining and foggy out there, a lot of you guys don't call. You think you're going to get electrocuted or something on the phone. That's not going to happen. So 1-877-969-8600. So Doc Hall talked about something that we really preach at the Lange Eye Institute. So when a patient comes in and they have some diabetic retinopathy, they're suspicious of glaucoma or do have glaucoma, they got macular degeneration, and they're overweight, we always counsel them on weight management. Folks, that's the number one thing you can do for your health. I don't care if you have arthritis, if you have high blood pressure, if you have diabetes, you're depressed, okay? You have no energy, you have lung problems, you have macular degeneration, you have glaucoma, you have diabetic retinopathy. The number one thing you can do is control your weight. Get down to your ideal body weight. Sometimes it's a lot more difficult. It's easy to say, right? But you can do it naturally. We've had patients that have lost. We have a patient that was 600 pounds. Now he's 300 pounds, okay? 400 pounds, and now he's 200 pounds. So we have people that lose half their body weight. We're their eye doctors, and we help them naturally, all right? We're not giving you any of these drugs, these diabetic drugs that help you lose weight that may have some side effects you don't want. We're not doing gastric bypass surgery. We're not putting you on a crazy diet that only has protein that can cause you to go hypoglycemic and pass out and have some serious issues. I mean, we cut your calories. We give you more exercise. We put you on specific supplements that do work. So talking about that really briefly, a good way to lose weight is called the Healthy Weight Loss Bundle by Fortifeye Vitamins. And it explains everything. And you don't have to use the Fortifeye. You can just look at the Fortifeye, look at the nutrient profile, read our directions, and try to find something similar. So the Healthy Weight Loss Bundle, go to the bundle section at fortifeye.com. Go to the bundle section, and you'll see Healthy Weight Loss Bundle. It tells you what to eat. It tells you what's on the Lange Survival Diet. It actually shows you pictures, probably 30 different meals that we've prepared. It tells you exactly the recipe. So it makes it very simple. And then one meal a day, it's pretty simple. You take the organic blue-green superfood I'm holding up, 1 scoop of that, and 1 scoop of the whey protein. It doesn't matter which one, whether it's the super protein or the grass-fed whey isolate. You shake it up in water, not in anything but water. I didn't say soy milk. I didn't say coconut milk. I said water, all right? There's no calories in water. Water's not fattening. And so you shake it up and you drink it for breakfast on Monday, for lunch on Tuesday, for supper on Wednesday, and then you go back to the cycle again. So it's basically a meal replacement once a day, but not at the same time. If you do it as a meal replacement every day at the same time, your body goes into starvation mode and your metabolism slows down. You just don't lose the weight. So once again, 1 scoop of organic blue-green superfood. Folks, this is like 16 different organic, gluten-free, FODMAP-free fruits and vegetables. We tell you exactly what's in it. 6 adaptogenic organic mushrooms, enzymes, and probiotics in 1 scoop for, like $30. That's a good deal. If somebody was selling this, on the internet, usually it would be over $100. And then the whey protein. This is grass-fed New Zealand non-denatured whey protein, 20 grams of protein, only 20 calories in the superfood, probably 80 calories in the protein. So you're looking at 100 calories, 21 grams of protein, and all the fruits and vegetables you need in one day. So check it out, Healthy Weight Loss Bundle at fortifeye.com. Fortifeye, fortifeye.com. Now, if you don't want to lose weight and you just want to be healthier and get some more nutrients, more fruits and vegetables in your system and grass-fed whey protein, that is not only good for your muscles, it's great for your immune system. You can have this in between meals. That's what I do. I have it in between meals 5-6 days a week. All right, phone lines are open. 1-866 1-877 969-8600 1-877-969-8600. I see somebody chiming in and on Instagram asking me, Dr. Lange, I'm excited about the Fortifeye Rejuvenate. I had pre-ordered it about a month ago. Please tell me when I will receive it and which is your favorite flavor. All right, so yesterday all of the pre-orders went out, so you'll probably get them today. If not today, you'll get them Monday. So anybody that ordered Rejuvenate, all flavors except chocolate. Chocolate is not going to be in until Monday. So chocolate you probably won't get till Wednesday or Thursday of next week. But if you got the cherry vanilla, the pink lemonade, or the unflavored, they went out. And my favorite is probably the cherry vanilla. It really is. But chocolate is delicious, and so is the pink lemonade. They're all pretty good. So once again, Fortifeye Rejuvenate is in now. Come on by the Fortifeye Nutrition Center today. I'll be there about noon, maybe 12:15, and we're going to do taste testing. So we're going to open up the Fit Pros. We're going to open up the Rejuvenates, shake them up in water, probably Wata water, the best water on the market. Shake it up and let you guys and gals taste it, and you see how amazing this stuff tastes. Remember, the Fortifeye team, Dr. Hall and me and the whole gang, we worked on these tastes forever. I mean, for over a year to dial it in. And remember, no sucralose, no aspartame, no asulfide potassium. These things are very bad. They disrupt the microbiome in your gut, and they can cause potential health issues. All right, we're going to finally take a phone call. Doc Hall, chime in really quick, and then we're going to go to Tony.
Absolutely. And I'm going to cut my mic off, I promise. I just want to remind folks that on Mondays, I dedicate the entire day to really quick, and then we're going to go to Tony. Absolutely. And I'm going to cut my mic off, I promise. I dedicate the entire day to consultations for nutrition and diet. And folks, they're free. There's no strings attached to this. I do them on Monday only. And all you have to do is just call our front desk, make an appointment with Dr. Hall, and you're good to go. Back to you, Dr. Lange.
Awesome. All right, let's go to Tony and Donnell. And Tony, good morning. How the heck are you, my friend?
And all you have to do
Hey, Dr. Lange, Doc Hall, how you doing?
Fantastic.
Good. Thank you, Tony.
Hey, so it's been a little while since I called in, but I'm calling in to tell you that you guys both knocked it out of the park with the Fortifeye Fit Pro.
Awesome.
I got 2 containers from Dr. Lange. The flavor is amazing. I got the pina colada and the fruit punch. I tried the pina colada first. The Fortifeye Fit worked very well for me. Between exercise and watching what I eat and the Fortifeye Fit, I've knocked off 140 pounds in total so far.
Wow.
Hey, good.
The Fortifeye Fit Pro blows the Fortifeye Fit away. It is so delicious. I want to drink more than 2 a day. It's unbelievable. When I called in, it was about a year ago, Dr. Lange showed pictures of me. Now my body is changing. I've got an abundance of energy when I work out now in the gym and behind my house. So if anybody's on the fence about the Fortifeye Fit Pro, gamble with that product because it's amazing. I don't get anything for saying this. I'm just telling you as a consumer what works, and this stuff is out of this world.
And Tony's been working out for a long time. Tony, people don't realize, was a professional bodyguard. He's a big dude. I mean, you're 6'6", big guy, all right, strong. I think you could bench over 500 pounds and, gained a little weight as we get older. But now he's a fat-burning, anti-aging machine, like he said, down 140 pounds. And he's looking pretty lean, I got to tell you. When he's sitting on that Harley cruising around, you better look out. You better not mess with that boy.
Yeah. Without the 140 pounds now, I can start throwing my feet over people's heads, and they don't see it until it's on its way back down to the ground.
Yep, Tony's got to be a bodyguard for my daughter when she goes to Tulane. You ready to move to Tulane, Tony?
I do what I got to do to protect you and your family.
Thanks. Tony's been a friend for many, many moons. His family and him have been a good friend for a long time, and
yep, started out as a client at the eye center and became more than family.
Yeah, I'm glad to see you're doing really well, Tony. Keep it up, and we'll talk to you again soon. But I'm very proud of you. You're doing, like I said, an anti-aging, fat-burning machine.
Thank you, sir, and I appreciate what you both did in the labs working that out.
And
thank you, Tony. We appreciate it. We appreciate you.
And thanks for that testimonial on the Fit Pro. All right.
You got it, bud.
We're getting ready to go to the next call in a second. 1-877-969-8600. Once again, give us a call, 1-877-969-8600. If you'd like to see any of the doctors, we're at the Lange Eye Institute in the Villages, Florida, okay? The phone number for the Lange Eye Institute is 352-753-4014. That's 352-753-4014. Dr. Susan Somerton, who is also a certified nutritional specialist like myself and an optometric physician. She's also fellowship trained in nutrition, and she's got a lot more degrees after her name and initials after her name than I do even. And so she's a great eye doctor to see and help you with your nutritional needs. And, of course, Dr. Lori Caputi has been with me for years and years, and Dr. Hall is there in his whole nutrition corner. We have a whole section for Dr. Hall in the optical with all the latest in Fortifeye supplements and other supplements. And remember, he does free nutritional consultations. All right, we got a couple of people on hold. We got two Steves on hold. Let's go to Steve and Valrico. Steve, good morning. Welcome to the program.
Yes, sir. I just wanted to find out what that Fortifeye Fit Pro, what the stuff costs.
The cost is $49.99 if you buy one at a time, and then there's a discount. I think if you buy two or three, you get 15-20% off. But remember, this is your whey protein, which used to be $46, and the Fit, which was $46, plus a lot of other ingredients. So we only jacked the price up $3 over the old Fortifeye Fit. So a lot of people were taking Fit and whey. So it's actually a pretty doggone good deal.
Well, what I want to find out is how long will that $50 thing last? How fast would you eat it?
So there's 30 scoops in there, okay? So
okay, for 30 days.
If you take one scoop a day, which is a lot of people do fine with just one scoop a day, then that's a 1 month supply. Now, if you're really wanting, let's say you're an extreme athlete, or you're really wanting to kick in a lot faster.
I ain't no extreme athlete. I just want to get back to where I was.
Right. I think it's not a bad idea in the beginning to take one before exercise and right after exercise, but one a day. If you're only going to take one a day, then this is how you do it. If you think you don't have a lot of energy, all right, you feel a little tired, and you haven't eaten in the last 4 hours, then take it 20 minutes before you go on a walk or exercise. But let's say you ate an hour and a half before, then take it after you exercise, okay?
Well, what about the sleep? Well, like, you shouldn't take it before you go to sleep, or so many hours before.
No, I don't think it's necessary to take it before you sleep. I mean, you don't need a lot of energy when you're sleeping, okay? Unless you're running a marathon in your sleep. So I would prefer you to take it, before. Don't take it at bedtime. All right. Now some athletes are getting up in the middle of the night and taking it at 1 or 2 o'clock in the morning to help with muscle recovery. But like I said, that's only extreme athletes.
Oh, okay. Another question I was going to ask you: what about the xylitol? Y'all do anything with that?
Well, I think as long as you don't give it to your dog, it's okay.
Yeah, right. It's not supposed to be for your dog, but
right.
but it does help your teeth, sure enough.
Right, that's a sugar alcohol, all right? And I think sugar alcohols are relatively safe. There was some negative press on erythritol not so long ago, and I think those are safer than sucralose and the artificial sweeteners. That's still a natural sweetener. However, since I have a lot of dogs, we don't put any xylitol in any of our products. We only use stevia or monk fruit. We don't use any of the sugar alcohols. I like the other, stevia or monk fruit a little bit better, okay?
Well, that xylitol is supposed to help your teeth.
Right. They
put it
in toothpaste.
You know, like if you have a cavity, it'll fix the cavity.
Well, I don't know if it'll fix the cavity.
If you have a pain, it'll start. What?
They do use xylitol in toothpaste. That is true, and a lot of dentists, stand behind it. But I don't think it's a miracle cure for your teeth.
I think it is a miracle. I think it'll save all your teeth. There's no reason to lose any teeth if you have the xylitol.
We got a whole show. Steve, we got a whole show we could talk about. We could talk about my wisdom tooth saga for 6 years. And let me tell you, I put a lot of the xylitol on it. It didn't help. I had to have it pulled eventually. But, Steve, thanks for the call. I appreciate it.
Believe it.
All right, let's see. We got to go to the next caller. I think it is Susan in Candler, Florida. Susan, thanks for holding. Good morning.
Hi. Hi. Thank you very much for your show. It's very informative. And the question I have is, what relationship can having like an infection in your teeth or like even missing teeth have to do with your eye? Say like if you have an infection in your mouth from your teeth and you don't really know it, can that do anything to your eyes?
Well, absolutely. I mean, it can cause sinus problems, and the sinus problems can go to your eye, and it can cause problems. The inflammation and infection in the teeth can go to the brain, can go to the orbit, and it definitely can cause problems, unequivocally without a shadow of a doubt. And that's why it's important to, have proper dental care. And if you have an infection in your teeth, to get it under control. I'm more concerned about it going to your brain and causing, a serious problem in the brain than to your eye. But yes, the eye is, right above the teeth. And I see many patients that can have some serious problems when they have a serious eye infection. So you got to get that under control. If you're talking about yourself.
Okay. Yeah. I guess I'm going to have to go back to the dentist.
Yes, sooner than later, okay?
Yeah. All right. Thank you so much, doctor, and thanks again for your show.
All right, Susan, take care. Bye-bye. All right, we're going to go. Let's see. We got a few people on hold. We'll take Steve in Clearwater first. Steve, good morning.
Hi, good morning. You know this product you have, it's called, I forgot the name of the product, something and brain.
Mm-hmm. Focus and brain.
To show you how important brain nutrition is to the brain. It used to be that many people with psychiatric disorders like schizophrenia and not Parkinson's, but schizophrenia and a lot of other brain disorders were people who tended to be born in April and May and June. And they never could figure out why. And they now think that it was because back in the days where before refrigeration and before modern food processing, people had to eat old food all winter. Do you follow my logic?
Yeah.
And so what happened is that a winter pregnancy was not as well fed in the nutrients as a summertime pregnancy was, because they all had their fresh fruits and everything there.
Right.
And it was tremendously different. Now that has evened out, and it doesn't exist anymore. But I think that study has shown that just how important it is that good nutrition is during for brain development and brain maintenance.
Oh, absolutely. And we try, anytime we have pregnant patients, we counsel them intensely on trying to eat more organically grown fruits and vegetables and tell them what to eat, what not to eat, because there's a lot of things you don't want to eat when you're pregnant as well. I'm glad I was born in September, Steve.
Yeah, well, that's the most, interestingly enough, the third week in September, yours is about right square in the middle, but the third week of September is the most common week of the whole year for births.
Why is that?
Because men are most fertile in the wintertime. because the temperature of the testicles is lower. That's why the testicles are where they are. To become cooler, they need to be about a degree or two cooler than the rest of the body. So men maximizing their fertility in January, add 9 months to that. What month do you get?
Huh? You're right.
There you go.
You hear that, Scoobs? This is February, so you're a month out. Scoobs might be thinking about having some babies.
Yeah, but one thing they don't understand is October and April, more twins are born, and they don't know why that is. So we'll leave that for maybe a 5-year telephone call from now.
All right, great. But,
okay, go let you go.
Thank you, Steve. Bye-bye.
Okay, God bless.
And talking about Fortifeye Focus and Brain, we got a couple of more people on hold, Doc, but Focus and Brain has been a pretty big hit, hasn't it, Doc, with our patients?
Absolutely. And what I like about it, Dr. Lange, we put our time and research into it. There's no two ways about it. But when folks get on this, I get phone calls back in the office all the time that folks had just been on it a short time, maybe even a few weeks. And they say, gee, I already feel a difference. I see a difference. And those around me notice a difference. So, there's proof in the pudding right there. I'd like to hear those calls, because it's not just us talking about our product. It's the actual patients, the customers, the consumers that are using the product. And, you and I are pretty good salesmen. I never like to say that, but, we can sell anything once, and any good salesman can do that. We're doctors first. We're salesmen down the road. Okay. But here's the thing with that. Is we can sell anybody one thing once, all right? If it doesn't work, it doesn't taste good, it doesn't prove out to be what we said it was, they're not coming back. Well, once somebody tries Focus and Brain, they come back. And I see it going off the shelves every day. And one thing, folks, I wanted to put out there real quick is that when it comes to Fit Pro, I hear it all the time. Folks don't like to start an exercise program because they get so sore and they get tired and this and that. Fit Pro is your answer to that, okay? No more delayed onset muscle soreness, as we call it, DOMS, and you get a full range of motion, ROM. And that means you can move. Your muscles aren't so tight and like that, and you're not sore. A lot of folks just won't do that. In fact, honestly, people say, Doc, you're going to exercise the rest of your life. I said, absolutely, because I don't want to stop and then come back because I don't want to get sore again. Well, with Fit Pro, you don't have to worry about that, folks. You can use that. It's got all the good things in there that you need, the protein, the collagen, the HMB. Creatine, it's got everything in there. It's made for you, and it's made for this. I know we're getting close on time here, so I'm going to say my goodbyes. And thanks, folks, for tuning back in today. I know we were off for a couple of weeks, and it kind of disrupted the schedule a little bit, but we're back. And listen, take care of yourself this week. Take care of others, and we'll see you next week.
All right, and we got a few more people on hold. I'm getting ready to take Jerry in 1 second here. Hang on, Jerry, just for 1 second. I got somebody that asked a quick question a while ago, and now they have double question marks because I haven't replied to it. Dr. Lange, you have talked about a meal for macular degeneration. I have macular degeneration, and I am taking your Fortifeye Macular Defense Next Generation. Thank you, but what is the foods that you recommend? That's a good question. So wild Alaskan salmon, all right, sauteed in coconut oil. Throw a little kale and or spinach and orange bell peppers in the end and saute it. Put an egg on top and then have a bowl of blueberries, okay? Because the wild Alaskan salmon is high in astaxanthin, the spinach and kale is high in lutein, the orange bell peppers are high in zeaxanthin, the blueberries are high in antioxidants that are great, and the egg is great because it has lutein and zeaxanthin. And I think we're almost out of time, huh? Geez, I don't have time for Jerry. Jerry, I apologize. With that, we're about out of time. We got 22 seconds. Jerry, you have to call back next week. Once again, I'm sorry. I want to thank everybody for tuning in and listening to Ask the Doctor. Check everything out at the website at Fortifeye.com. Come see me today at the Fortifeye Nutrition Center. I'm out of here. Have a great day. God bless you, and God bless America.